had a normal pregnancy and a normal delivery. Everything seemed fine afterward, and about 12 hours later, they came into our room and said that they needed to transfer Garrett to a level 3 trauma hospital. At the hospital, they continued with a whole bunch of testing. Nothing really came out conclusive except for the fact that he was extremely hypotonic, meaning very low muscle tone, epilepsy, was not eating. That was the big problem. He was not sucking on a bottle or sucking on anything, and wouldn't take any nutrition except for via NG tube down his nose. At 6 weeks, we could take him home if we got a feeding tube put in his belly, not the NG tube through his nose. And now today, he's 6 years old, and we haven't fed him orally since he was 2. Garrett is an undiagnosed mitochondrial disorder patient, just meaning that he doesn't have a diagnosis solidly. Because of this, he's on 20 medications to help with several different disorders, including brain, respiratory, and GI issues. His main daily care that we have to do revolves around respiratory, which all of these medications wreak havoc on his GI system, giving him anything from constipation to diarrhea on a daily basis.
Different digestive disorders include gastroesophageal reflux disease, lactose intolerance, celiac disease, as well as disorders of the small intestine and colon that would include ulcerative colitis or Crohn's disease, as well as the functional disorders of the GI tract, such as irritable bowel syndrome.
When you have diarrhea, obviously, just as a newborn would, you get diaper rash. And the hardest part about that is he's a big 6-year-old, and he's on his back a lot, he's on his sides a lot, he doesn't like being on his stomach. So to try to get rid of diaper rash after the skin's been broken and rubbed raw, you're always on your bottom still. So it's very hard to get rid of it once you have it, once he has it.
Probiotics are supplements of good bacteria and yeast that we give to patients to contribute to their gastrointestinal health. The colon and small intestine are full of bacteria. The thought is that if we give patients supplements with good bacteria and yeast, that this will eliminate the space where bad bacteria and yeast can grow, and it is the bad bacteria and yeast that cause symptoms such as gas, bloating, diarrhea.
On one of the many occasions that he's been on an antibiotic and he had diarrhea, one of my nurses said, "You need to get him on probiotics. It's the good bacteria that he's losing from having diarrhea from being on antibiotics." I found Florax DS when looking for probiotics. It stuck out because, first off, it's the only liquid. It's safe for children, so it made me very comfortable to use with him. And the other thing we love about it is you only have to give it once a week, whereas many of the others you have to do daily. Today, Garrett no longer gets diarrhea, which results in no diaper rash, no broken skin. And on the other side, he's no longer constipated either. He's just much more regular, all because of Florax DS.
Ideally, we'll give intermittent treatments of antibiotics in severe cases, but allow the patient to take a natural way of getting good bacteria and yeast by taking a probiotic.
We've been so happy with the Florax DS product that we looked into the other Hebron products. And my husband does get occasional heartburn, and they have Kios, which has helped him with that. My husband and I also take Florax DS along with Garrett because while I was looking up the products, I found that they also help your immune system. And we need to keep a healthy household for Garrett, so we all take our Florax DS on Monday.